Hi, good morning, everyone. Today, in our Impact Talk episode, we have Raj Mariwala from Mariwala Health Initiative. I welcome you, Raj, to this Impact Talks. Thank you so much for accepting this invite to come and speak about your initiative.
Hi, Shrishti, and thank you to CSR Box and you for taking the time out to chat with me today. I'm excited about our conversation.
Great. So quickly jumping into the questions about Mariwala Health Initiative, because I'm very curious to know, would you like to tell us about how you came about finding and establishing Mariwala Health Initiative? What was your motivation and passion behind establishing a health initiative?
So, actually, I will have to tell you a story. Um, and this spans back about 7 years. When my father said to me that, I've given up part of my business, I really want to focus on more philanthropy. And he said that he's already doing some philanthropy because he has a foundation called Ascent. And he also works on something called the Marico Innovation Foundation. But he wanted to do more. And he asked for my suggestions on what were the topics. He had two interest areas, health and education. So at this point, I said to him, why don't we look at mental health? And he had no clue about this field. So my first kind of job was to convince him and align him on what this meant. And so I took the help of a mental health professional and a friend called Dr. Shruti Chakravarti, and she started to explain to him as well as introduced him to a few other professionals. So once he spoke to 4 or 5 people, he understood that mental health is really underserved in this country. There's hardly anyone working on it. The need is very high. And then he was convinced about mental health. Now, for me, this is an area of passion because it's an area that I've always been interested in. I tried to do a few psychology courses in my undergrad, I've done a few diploma courses as well. And so it came from a personal interest area for me, but also from the fact that I myself live with a mental illness. And I've had the privilege of being able to access the language around it, a diagnosis around it, and of course, care and support around it. And so many people here do not have any of those privileges. So for me, I think the kind of passion to do this came from two different places. As well as the third place was that as a feminist, I really believe that mental health is a feminist issue. And it's very connected to the other spheres of our life, which could be livelihood, it could be a right to live a life without violence, it could be a right to have community, family, care, and support. So that's how MHI started. And my father has also spent a lot of time, I think, learning more and more as we spend more time working on mental health.
I think that's a beautiful backstory to, to be able to actually think of something, be be having an issue with something, living with something, and then actually thinking of helping others and creating this initiative to help others living with similar kind of situations or having problems. And rightly said that I also agree that it's a feminist issue. Like I agree that mental health is a totally feminist issue, that women when are aware more about mental health can live a better life and a life without violence also sometimes. So that's absolutely correct. Moving on, with this story, I would also like to understand what is the philosophy or the core mission of Mariwala Health Initiative. What is the core mission that you as a founder see in the Mariwala core initiative, like mental health initiative?
Yeah, thanks, Trishti. So, again, when we started off, we said, what are we going to look at? And the whole idea was, how do we reach people um, who need to access care the most? Now, this means that our focus has to be on those who are the most marginalized. So I think our whole initiative started off from that, and we said we are going to focus our work on making sure that mental health is accessible to historically marginalized communities. Now, this can be done in many different ways, but the whole idea again was there are some problems with mental health care in India. One is just sheer distance. If you live in rural India, how far would you have to go to access mental health care? Would you be able to access mental health care in a language that you speak? Right, it's very important. Part of the problem of mental health also is that so many resources are only in English. So, what about languages? What about cost? What about linkages to other things? It's not enough to say that I will help set up something for talk therapy. It's not enough to say that I will set up something where a person can even get maybe access to a peer counselor, but also to say, how do we link people? If someone is facing domestic violence, how do we link them to a counselor, to legal services? Because especially in a place like India, it's not enough to do just what we would call, I guess, traditional mental health, which means that our approach, our vision has always been psychosocial, which means yes, we are focusing on the mental health aspect of it, but the social linkages of it are as important. Connecting people to welfare benefits. One of the key things with mental health is that for many people who do live with a mental illness, you get excluded from so many spheres of life, be it getting a voter ID, be it getting a ration card. So, a lot of our services also look at providing that. So, the vision has always been that mental health must be accessible and linked to a wide range of other social, governmental, community based benefits. It must also, I think, mean that people who are part of their communities must be in charge of mental health care support. So, a lot of our work is done in partnership with grassroots leaders because the whole, I think, vision is nothing about us without us. So, if we are looking at mental health, one of our partners who works with Adivasi communities around the city of Bombay, it is led by a young Adivasi leader herself. So, the whole idea is that mental health must be led by leaders from within their own communities. And that's the vision of MHI, but also because MHI functions as it does, we have a responsibility to do advocacy for mental health. So we quite routinely reach out to government, to other types of actors, it could be business, on how to introduce or how to foreground mental health in their work. So that is also very much part of the vision of MHI.
Great, thank you so much. I think I also loved the fact that, when there's a community, when you spoke about the language of it. So when you want a certain kind of a help, you are already having challenges with dealing with something. And then there's a language added barrier. And um, as you said, most of the mental health support material is in English language, which is a challenge. I feel that there's amazing work being done by you, especially when you talk about your Adivasi community and how an Adivasi women leads that community for mental health support there in your area. But let's say when we are talking about this, and you've also shared that you yourself have been facing and living with some mental health issue, could you elaborate on your personal and professional journey that brought you to start working on such a crucial issue as mental health, right? Because I am sure we have all faced some or the other kind of an anxiety, or sometimes we also face stress. It could be healthy stress, could be non-healthy stress. But we don't realize until we are diagnosed that it's a challenge, right? So just asking you if you could elaborate on your personal and professional journey that brought you to start working on such a crucial issue.
Yeah, so I mean, I think it's obviously, it starts off as personal for me. And when I say that I had the privilege to access the language. Now, the mental health condition that I've lived with, I've always had it. So for me, I didn't even realize that it was anything different. I just, in my head, I thought everyone lived like this, right? Or everyone went through these thoughts, feelings. It was only a little later on, when I was slightly older, and I was taken, by the way, to different kind of clinics and other things. But I don't think at that point, when I was very young, that people were able to come to any sort of idea. And at that point, it was just like, huh, okay, we'll do an IQ test. Everything is fine and normal in the IQ test. So now no more intervention needed, right? Um, so it took that much time for me to be like a young adult almost, or a teenager, to realize that actually this is not how the world lives. And so that's part of the privilege. But I also then had the agency and control personally, right? To do whatever I had to do, which meant not just taking medication or not just accessing therapy, but it also meant changing my life around, so that I don't feel the stressors. Right now, what do I mean by that? I'm actually trained. I have a double bachelor's degree, and my master's degree is in business administration. I have an MBA. So technically, I should have been, I don't know, sitting in some corporate office doing whatever it is. But because of how my brain is figured, or because of my mental health, I realized that actually this is not the best space. Am I capable of doing this work? Sure, absolutely. Is it best for my mental health, for my life? Probably not. And so, in my personal life, I had the privilege to say, I'm actually not going to work on this profession anymore. I'm not going to work in the corporate arena where I will be sitting in some sort of AC office surrounded by people. That's just not going to be good for my mental health. And I can take all the medication that I'm taking, it's still going to be terrible for me. So, how do I make a lifestyle change? And I was able to make that lifestyle change. We hear this a lot, right? When it comes to disease and mental health, make that lifestyle change. But are you able to do it in your life? Do you have the privileges to make that lifestyle change? And I, of course, I do have them. And so I did make that lifestyle change. And what I ended up doing was, I ended up formally studying and then becoming a professional dog trainer and canine and feline behaviorist. So, yes, I have an MBA, but now I have formal training, and I do still very much work in the field of canine and feline behavior. It allows me flexibility. It allows me, different kind of situations and scenarios to work in every day. It allows me to move around and not be stuck in some office space. And I do still work with dogs and cats, right? And it allows me to do something that I love deeply. Uh, so, that's what I mean when this is my personal journey, that lifestyle change. And how it became professional is that, like I said earlier, I'm a feminist. And in that sense, working on MHI, Mariwala Health, allows me the space, I think, for my political, as in feminist, um, activism, you can say. So that's how I started working on it professionally as well. And now I do both things. I work with dogs and cats, but I also work on Mariwala Health. And of course, I have found ways in which to make both of these meet, because I do run a course for mental health professionals on how to integrate animals into their clinical practice. And I myself personally train therapy dogs. So, for example, even my own one of my pet dogs sits in for therapy sessions sometimes, because he's trained to do so. So I think there's a bunch of things that personally and professionally, um, that matter for me when it comes to Mariwala health. And of course, it has given me even more insight, I think, into my own mental health, but also as an example, I would say, because not enough leaders of organizations talk about their own mental health. Today, I'm able to tell my whole team, and then it makes it safe for the team as well to say that I live with XYZ condition, or for me to say that yes, I actually have a learning disability, and so someone else will have to help me out when I do this, which is true. I do have a learning disability, and that's, I think, important for me both personally and professionally to take that stand.
Wow, I think it's very interesting integration when we hear about, dogs and cats being therapy partners for you when you are undergoing a mental illness. And I think it's quite popular amongst the Gen Z and the millennial generation as well. I've heard my friends talking a lot about having a therapy dog, and not just jokingly, they are absolutely serious about it. So I think it's a good integration, and I would love to connect with you separately on more, to understand more on how it works. And as you've mentioned in your personal to professional journey, I think it was a beautiful integration of not just like helping yourself, but also coming out to help others, and then with the philosophy of doing what you love instead of love what you're doing, because that's what I figured, that you might be an MBA and you're fully capable to do that, but maybe that's not the best environment for you to thrive, um, to work in a corporate. Correct me if I'm wrong, Raj. So I think that made absolute sense to me. And sometimes as an growing adult, we also question ourselves, that is it the right place, right time, or was I at the right course of my career, at the right space? And then I think I'll move on with my question and give my statements later on, because you are absolutely clear. We all are aware that COVID-19 has come as a very big wave of not just like emotions, but other illnesses along with it. And uh, and it has been a worse situation for everyone globally. So on those lines, I would like to ask you, how, according to you, has COVID-19 changed the mental health landscape in India? What are the challenges in this field that people have faced during that time, and how is it working to overcome them, according to you?
Right, thanks. This is an important question because, again, I'll do this historically. So, when we first started Mariwala Health, everyone that we spoke to in mental health said, don't have the words mental health in the name of your organization. And I really wanted to have the words mental health in the name of the organization. But then, okay, fine, we switched it to Mariwala Health. There's still MH in the name. So I was okay with it. By the time COVID had come around, the words mental health weren't as stigmatized in India. Okay, and that was, I think, very largely, honestly, due to Deepika Padukone talking about mental health. Right, that was a massive change. But of course, it wasn't as widespread. Now, what COVID did is truly visibilize mental health. It got a whole lot more people talking about mental health. It became, I think, it became a conversation that entered the mainstream. Right now, it's unfortunate that it took something like COVID to do so. But I think the second important part of what happened during COVID is that people realized that context is important. I think before COVID, people just thought that mental health is something that is fully residing inside an individual. It's a completely individual phenomena that has nothing else to do with anything outside. Maybe a personal fault, maybe a personal genetic issue. These were the sorts of ideas. Okay. But once COVID came around, people actually realized that context is important. What happens when I'm uh, inside a home continuously? What happens when I'm not allowed to go somewhere? What happens when I'm in fear of losing my job, right? And so I think quite a few people understood that context is important. Again, I think the whole idea of mental health as purely individual just adds to the stigma. And so all of a sudden, we had people saying anxiety is normal, right? Now, this was new for me, right? Of course, anxiety was normal for me. I live with a complex anxiety condition. And even if I take medication, it still exists for me. But all of a sudden, here now you have people saying that anxiety is normal. And I think that did a lot of different things for people. We saw a whole lot more conversations on mental health at work. We saw some conversations around domestic violence and mental health, right? Because COVID, there was quite a few, I think, articles, lots of people speaking about how during lockdowns, the domestic violence helplines were getting more calls. So all of these more conversations were happening. But I think if I have to point out the flip side of this, these conversations still happen and are only about those of us with privilege. And what do I mean by that? Again, conversations on mental health at work, we are only talking about urban, white collar people who live in offices. Do we talk about mental health at work of daily wage workers, of sex workers? Do we talk about mental health at work of those who work on factory floors? Conversations have not reached there, and that's because people like us are still in charge of those conversations. Similarly, now with domestic violence and mental health, actually, India as a country has a very high rate of suicide, death by suicide for women. We make up 17% of the world's female population, and that accounts for 34% of the world's female death by suicide. Okay. And a lot of the reasons are related to domestic family violence, partner substance abuse. And so, again, these conversations are just staying as conversations, and we need to make some changes at our institutional level, at the structural level, if we are really to address with these issues and engage with them fully, right? COVID also saw a lot of mushrooming of different telephone helplines and such. But again, how accessible are these services is a question mark. And so I think I would almost say in a post COVID scenario, what are we doing now to look at the mental health of migrant communities, right? And that's something that came up a lot during COVID. So it's important actually to take this, especially for those of us who work in the mental health field. We did get more visibility of mental health. And now, what are we going to do with that? How are we going to actually harness it, work on it better so that more persons are able to access care and treatment with agency and choice? I hope I answered that question.
Yeah, I think you summarized it so well with so I don't have to like conclude to this conversation on this question. This was such a beautiful summarization that we got the visualization, but what next? So I think I'll leave that to for our viewers to think what next on the terms of mental health. Moving on, just one other question that I was very intrigued to ask you is, can you elaborate on some of the crucial learnings that you had while running Mariwala Health Initiative? You might have come across a lot of challenges and learnings throughout your journey. And second is, what would be your advice to your young professionals who want to work in this space?
Okay, great. Excellent question. I think my first learning actually came very early on, and that was that there is so much amazing work on mental health already being done in this country. So be very careful when you want to reinvent the wheel. There is amazing work being done. Look to that work for learning, for building upon that work, or for spreading that work further. That's one learning. The second learning, I think, is on, I would say, particularly now on technology. A lot of people are looking at technology to kind of solve the challenges that mental health as a field faces. And I would say the learning has been be very careful about not creating further divides and gaps in the name of technology and innovation. So I think one of my favorite things to say to people is that yes, technology is great for mental health. We should absolutely use it. Am I talking about apps? No. The technology I'm talking about is called the telephone. And I'll give you an example. Even during COVID 19, when lockdowns were happening, one of our partner organizations who works with homeless persons in West Bengal, they were able to keep in touch, they were able to provide care because they handed out cell phones to their community of homeless people that they work with. And that's the power of technology. Am I going to use an app? Probably not. And to date, actually, we don't have any app based work at MHI other than one thing, which is an app that was developed to build on the Mental Health Care Act. So that's learning number two. I think learning number three is always remember that mental health is a public health issue, it's also a development issue. And especially for low and middle income countries, our mental health is deeply connected to the rights to access employment, livelihood, education, uh, again, women's health, women's rights, also physical health. Because a lot of times in India and other developed countries, people with mental illness actually get ignored by the physical health systems. People with severe mental illness die about 15 years earlier than the general population due to physical health reasons because they are not caught in time, right? So we really need to look at how to integrate mental health in a public health sense, sorry, as well as a developmental issue. That's number three, I think. Learning number four is mental health is intersectional. Always remember that. And it's related to the intersectoral nature of mental health. So whoever is historically marginalized is going to have a harder time accessing care and support. And so ensure that you do that. I think my biggest or my favorite line when it comes to Mariwala Health and the work that we do is, if you build systems while foregrounding the margins, you will cover everyone. If you build a system while foregrounding the center or the most privileged, you are never going to reach the margins. Okay, and that just means that if I start off with a clinic somewhere in South Bombay or in South Delhi, I will never be able to adapt those services to reach a person in uh, rural Shillong. But if I start off some services in a district, in a rural district in West Bengal, there's a very good chance that I will be capable of spreading that, reaching more people. And so for me personally, I think the learning is really foreground the margins, because the system is made for the privileged, is made for the center.
Great. Now, could you also give us some advice to young professionals who want to work in the space of mental health?
Okay, now, okay, this is the toughest question for sure. Advice that, okay, I think the advice is, I think we do have quite a few institutions that, teach psychology, that teach the side disciplines. And I would say that it's very important for young professionals to look at the history and the legacy of mental health. If you do not know this, please look it up, please read about it. It's very important to acknowledge that history, because that history has also in itself been violent. And if you want to build a rights based practice, if you want to do rights based work, it's very important to acknowledge it so that you don't end up making similar mistakes, because our curricula still have not caught up. It's very important to do some continuing education around it, because remember, our curricula is also based on certain privileges and learning only again from the center. So learn from the communities or the people that you want to work with. Foreground their voices. Again, I'll give you an example. If you are going to work with LGBTQIA communities, please listen to their lived realities, listen to knowledge from LGBTQI communities, because that is valid, and center that in your work. And I would say that for young professionals who are excited about doing this, I think it's always very critical to get a mentor, or in more, I would say, mental health language, if you are a practitioner, to get supervision. And that is harder to find in this country. It's actually a problem, but ensure that you get good supervision for your own mental health. And number four, I think it's critical that you yourself get mental health support, okay, which means accessing therapy, because until and unless you take care of yourself, this is a hard field to work in and you will burn out.
Wow, I think the last point summarized it all. Like, you want to work about it, but do not forget to take care of yourself. So, last question of the segment to you, Raj, would be, what is your vision for this space and your organization for the next 5 years? Where do you see MHI to be in next 5 years? And like the whole mental health space in all will be like, will it be more improved? Will it be, at the same space that we are at? What do you think about that?
So I think in the next 5 years, I think my one wish, which has been there for quite a while, which is changing now, luckily already, was MHI was one of the very few philanthropic organizations that supported mental health in this country. A domestic organization, okay, Indian organization. One is, we've been working on it, and my wish is that we get many more philanthropists, CSR, to actually support mental health. I don't want to be one of the few organizations who do this. We have to get stronger by having more organizations working together to do this and supporting grassroots level and other mental health initiatives. So that's one. And so I hope to have many, many more in the future, and that includes CSR. I think number two would be uh, to have far more implementation of the mental health laws in this country. Now, we do a lot of advocacy work so that the government does implement the laws. We have some fabulous laws which are unfortunately remaining on paper. But again, if we can have more citizens, if we can have more young people advocate, tell their politicians that it's very important. Please make sure that district mental health plan is being implemented, act is being implemented. That would be absolutely wonderful. And my dream is that more young people in the country are able to take this up, are able to tell their politicians, their communities that mental health is important. And I think that's already happening a little bit. We also have an advocacy kit for youth in case there are young people listening. It's on our website. So look it up. I think number three would be a particularly big challenge for India, which is our suicide rates. India has one of the highest deaths by suicide. Our young people are dying by due to death by suicide in record numbers, and that's something that we really hope to work on and engage with. These are preventable deaths, and many people are affected, and suicide really needs to be taken up as an issue, as a public health issue. And again, many more people are required, workspaces, educational institutions, different government ministries to take this up and work on it. So that's, and now I'm just giving you my wish list, of course. Um, I think finally, I would hope for, of course, more mental health care to be accessible. So, what would that dream look like for primary health centers to be trained at certain basic levels of mental health care and support? And of course, to have more peer counselors out there, because it's not just about the mental health experts, very clearly. People who share contexts, who share different lived realities, can be a strong source of support for each other. And I think that would be also my dream in the next 5 years, to have more of that. As well as, I think finally I'm going to like shove this in more, I think, social support networks, welfare networks, um, for the persons who are multidimensionally poor and homeless, because we're finding that that has, I think, massive mental health impact.
Amazing. I hope that your wishes do come true, and we are all here to witness it and celebrate it together. That when after 5 years we see that PHC members are trained in mental health practices, people are actually going and accessing those facilities that are being provided. And there's more peer support in terms of talking about mental health, because there's one thing which is institutionalized mental health care, which is the mental health professionals that are working, which is the psychologists, psychiatrists, other people. But I also feel that peer support is very, very important. That's just to my personal understanding that I can feel, because what I feel, while whatever limited small amount of time that I've worked in mental health, I realized that you don't go to a therapist every day, but you face mental health challenges or stressors for that matter every day. So so you talk to your peers, and I feel that when you are talking to your peers, there should be a very good understanding where what to be answered to your friend. And especially that by suicide with young adults these days, as you've mentioned, I hope that we are all able to stop it, prevent it from happening, and reduce the numbers together. Thank you so much, Raj, for coming and joining for this discussion. And it was lovely hearing from you. And I hope to see you soon, sometime again.
Thank you so much, Shrishti and CSR Box, for having me. I love the fact that different team members do this interview, so I got a chance to meet you.